my heartiest thanks to and gratitude to Dr. Shamsul Arifin and the ICDDRB team for inviting me to present in this August gathering and to speak on the program. Respected Chairperson, Professor Farhana Dawanapa, Professor of Obs and Gynae, and President-elect OGSB, and in front of me, Professor T.A. Chaudhuri, Professor Halida Hanumappa, and also Professor Shala Khatun is not there, but we are proud of them, and congratulations to them, and my senior teachers, colleagues, and my colleagues and participants from other organizations and learned audience. A very good morning to you all. And I will present mainly on the current status of cervical cancer screening, but also focus on elimination of cervical cancer in Bangladesh. Remote. Learned audience, if you see the incidence of cervical cancer, in 2012, Globocan showed that there was about 60,000 new cases of cervical cancer in 2012, and now, though it has increased to about 68,000, but there is some reduction of cervical and breast cancer. There is about 7.3% reduction of cervical cancer, and it came down from 19.3% to 12% of the female cancer. We all know that HPV is the culprit for development of cervical cancer, and it takes about 10 to 15 years to develop the precancerous condition. And if we can treat this precancerous condition, then it will not be developed to cervical cancer, and we can prevent cervical cancer. Now, you see this, there is different methods of prevention of cervical cancer, and one is the HPV test. And only few developed countries so far could develop this HPV test for screening, and a large number of countries also they could adopt, developed country. They could adopt the Pap smear, which was initiated since 1950, and developing country, they are still continuing the VIA method, that is the visual inspection of cervix with acetic acid, and this test is offered free of cost from the government in Bangladesh. So you can see that India, Bangladesh, and some other countries still following the VIA method. Whatever method is used for VIA for screening, ultimately all this screening positive patient, which range from, in Bangladesh around 4 to 5%, they need to have the colposcopy test. I will speak on that later. Now, government started the pilot program in 2005, and BSMMU, Bangabandhu Sheikh Mujib Medical University, and UNFPA initiated the program in DGFP during that time, and the program was scaled up to by 2010 to all the district level, like the medical college hospital and all district hospital, and the maternity hospitals initiated VIA test. There is no program, active program, since 2010 to 12, and during that time, the program was shifted to DGFP to DGHS. And in 2012, the ministry initiated a project called this Establishment of National Center for Cervical and Breast Cancer Screening and Training, and started extension of the program to the sub-district level and developed 200 centers by 2018. And later on also, MNCAG, UNFPA, WHO are also involved in extending the program further, and also Ministry developed a new program for electronic data tracking and monitoring. So far, there is about 600 centers, all district hospital, government medical college hospital, many institutes and maternity hospitals, and 424 Upazila Health Complex. They have the VIA and CB Center for cervical screening, and at the same time, screening of breast by clinical breast examination. Also, some NGOs, they have also the centers. Now, these centers offer VIA tests. Initially, it was for 30 years and above, all women for 30 years and above. But now, for 30 to 60 years of age, they are getting the opportunity, and the government developed registry, cards, etc. And implementation is continuing. There is also camps for awareness creation. There is some billboards. There is brochure and some orientation meeting and meetings at district levels are happening. Curriculum was developed in 2006. Again, it was revised in 2014 and 2016, and even the IRC also participated in revision of the curriculum, so we developed a standard curriculum, and the performance is going on. You see that though it was very, it was slow at the beginning, but gradually it is improving with extension of the program, and also now with the development of the community clinic and more Upazila Health Complex, with about 1 million VIA is performed every year now. So almost 4.5 million women has been screened and free of cost, and the positivity is about 3.6%. The coverage of the population is around 20% of the target group. At the same time, clinical breast examination is going on. The positivity is about 1 to 3%. Now, VIA positive women, they need colposcopy. They need further, say about 3 to 5% women are positive, and they need colposcopy test for finalization of their diagnosis and for treatment. For that, we started training, and we use the IRC, International Agency of Cancer. They developed a guideline for colposcopy, and we always follow that guideline. And every year we train colposcopists, and so far 43 colposcopy clinic has been developed throughout the country. And there's lots of problem like transfer and other things, but every year the training and the quality control is going on. And so basic training was initiated in 2006. Advanced training is also continuing, and also our master trainer travel abroad to get further training. So we introduced quite sophisticated treatment, world standard treatment for treatment of cervical precancer, because when there is abnormal cell, we need to treat them to prevent the cancer. For that, LEAP was introduced since 2006. That is the excision of the transformation zone, large loop excision of the transformation zone, or loop electrosurgical excision procedure, where just part of the cervix is removed by the small wire connected to the electrosurgical or cautery machine. Before that, we need to evaluate by colposcope, though it is a big equipment, also placed in all the colposcopy clinic, 43 colposcopy clinic in the government medical college hospital and institutes. And several private medical colleges, they are also developing. And there is also pocket-sized colposcope that is known as gynocular, and that we can use in the camp or in the sub-district level. For treatment, the LEAP is the standard procedure, but there is a small risk of bleeding. About 2% patient can get bleeding. That's why thermal ablation is introduced, and that is ablative method, just destroying the abnormal cell by heat. And that is gradually getting popular, and Bangladesh is using almost 100 thermocoagulator to treat the women, the precancerous condition. Now, there is difficulties, to attend the colposcopy clinic. Women come from quite far distance, so that's why one-stop services has been introduced by the government, and once we see any positive thing by the colposcope, we treat during the same visit with or without biopsy, and WHO also recommend that all women does not need biopsy really, which is not available even in many government medical college hospitals, though it should be available there. Government also developed national strategy for cervical cancer prevention and control, and which introduced the plan of vaccination, and most of you know that for human papillomavirus vaccination, in Gazipur, government did a pilot program since 2016 to 17. It was completed very successfully, and we are waiting to get the vaccine from Gavi. Maybe we can get it next year. EPI is working hard for that. And also in the strategy, government said that implementation and scale up of the organized population-based cervical cancer screening should be introduced. And for that, the government and all of us are working, and strengthening of the health system and other things are also there. And also government said for monitoring and evaluation system is very important, and for that electronic data tracking with population-based cervical cancer screening program is necessary, and this can track the woman. Every individual woman have separate database, and for that there is a dedicated server at MISDGHS, and it needs the electronic national ID for the initiation of the basic demographic data, which can be done at the community clinic, Upazila Health Complex, Medical College Hospital, and institutes, etc. And then in the second phase, the VIA nurse introduced the result, VIA and clinical-based examination result, either positive or negative. And the positive women are referred to the colposcopy clinic, and in the colposcopy clinic, after colposcopy, the doctors and nurses, they introduce the result on the same page in the DHIS2. And management data is also inserted there. So you can see this is a tracking system. If the woman does not come back, we can track them. For this, the pilot program for electronic data tracking was initiated in 2018 in 200 Upazila, and it was successfully completed. And 5,500 community clinic was included. And awareness creation activity was also initiated from the community clinic level and other level. And the community healthcare provider and health assistant, FWA, and multipurpose health worker also, they are involved. And you know, this is a dream project of our Honorable Prime Minister, the development of the service in the community clinic, and it's such a nice program that this program could reach to the grassroots level, and they are getting the service now. Every community clinic, you know that they have 6,000 population, and for that 600 to 800 women usually need screening. They are within 30 to 60 years of age. For that, we developed master trainer, and we trained the civil surgeons and UHFPO and consultants at BSMMU, 2 days training on electronic data tracking and monitoring of the women, and also initiation of registration and referral system. Also, we trained the statistician, then the health inspector and MTPI as master trainer, and all of them are involved in the training of CICP, health assistant, and FWA at the Upazila, and they had 1 day training for 30 persons batch had 1 day training by this developed master trainer from district and Upazila level, and in that way the population-based screening was initiated. So the health assistant, FWA, they counsel the woman at home or during the EPI session, etc., any gathering they use, and they do registration in the hard copy, and that registration form has 2 parts, and 1 part is given to the woman and 1 part is given to the CICP in the community clinic, because CICP has the equipment for the registration, and they enter the data in DHIS to the basic demographic data, and once they are referred or directly coming to the Upazila Health Complex, they are having registration also, if it is not already done, and also counseling as service. And I have mentioned that colposcopy clinic in the medical college providing the rest of the service. There is no risk of data duplication because the unique registration number is there. So far at the community level, 11 lakh women, that is more than 1 million women had the community registration. Actually, this software was just developed, the community registration part during initiation of COVID, and however, it is getting better now. And individual data, already 1/3 of this women, this is a little bit old data, they had the individual data inserted in the DHIS2, and it is going on. We are now working on the colposcopy data also. All the colposcopies, they can also enter the data, and it is now implemented. The beauty of DHIS2 that the data can be monitored, and even the civil surgeon, they can see what is happening. All can monitor the data. We have a large target population, 22 million, and we have to do all this screening. Now, all of you know that WHO, they have introduced this elimination for cervical cancer, which included 90% of the girls will have HPV vaccine by age of 15. And so the government is working for that. And screening, though we are using the VIA test, but WHO mentioned about the human papillomavirus test. We have to think about that, and also the treatment of pre-cancer and cancer by 90%. So at least we can treat now 80% of the cervical cancer which are diagnosed. But for cancer, our government is also working hard. They're trying to develop the dedicated oncology center also in 14 medical college hospitals. And we are hoping that that will help in treatment of the diagnosed cancer also, because this is very important point for SDG. And SDG target 3.4, that we have to reduce 30% mortality from non-communicable diseases. And WHO mentioned about HPV DNA test as primary screening test after the age of 30, every 5 to 10 years. And you see the test by, the research by Athena improved the performance by double, and so many reasons for adopting this screening. BSMMU also initiated research on HPV, and you see that we had done a small research that showed 3.6% high-risk HPV among the target group population. ICTTRB and BSU also did another test, and that showed 4.2% women, they had high-risk HPV test, and we have to develop pilot program and we have to proceed further. I'd like to acknowledge all these agencies, starting from Ministry, DGHS, all government office, UNFPA, WHO, GSB, BDSCCP, and IRC always with us, Authority of BSMMU, all doctors, supports, and women and patients, and thanking you very, very much for listening me, and Joy Bangla.